webinar at a future date.
Okay, I think I've got it recording at this point.
Yes, you do. Thank you very much.
Great. Well, here's what I want to do today. I want to talk about what it takes to maintain strong relationships during challenging times, and especially thinking about the context of COVID, but it's not the only context. And I think probably everybody on this webinar is just keenly aware and sensitive to some of the challenges that older adults are facing right now. And really, frankly, all of us are facing, but particularly some older adults are facing these. So what I want to cover today is I want to spend some time talking about, let me get where my slides are advancing. I want to spend a little bit of time talking with you today about what we know about older adults' social relationships, why those are so important, how they function, how they change across the lifespan. And I want to spend some time talking about the efforts that we can put in and the investments and commitments we can put into improving relationships, even during difficult times. And I also want to talk a little bit about some dangers that can happen in relationships. All relationships are not good. All experiences in relationships are not good. And I'm going to end by sort of bringing it all together with some keys I think that can help any of us think through our relationships and sort of do what I'm calling an audit. You do have a 2-page handout, and you'll see sometimes during this presentation that I'll be inviting you to think about paying attention to that audit possibility, that you might actually use a worksheet like that, or you might use it with some of the people with whom you work. So with that said, let's start at the beginning. Human beings are relational beings. It's not just when we're infants that we need other people desperately. We need people throughout the lifespan. It's a core function of human existence. It's evolutionarily adaptive for us to connect with people in a variety of ways, and we're going to talk about some of those ways in a moment. Toni Antonucci and her colleagues started thinking about the relationship structures that we form across the lifespan as convoys. This was back in the 80s when she first started talking about this. And she was basically thinking about the old trucker convoy. And she said, you know, individuals move through the lifespan surrounded by people, and we kind of collect people as we go, much like a convoy does. And sometimes somebody spins off, much like a trucker convoy does. And it turns out that after decades, literally, of research on this around the world, and she has collaborated with people truly all around the world, there is a robust set of evidence that in all parts of the world, your social convoy influences not only your life structure, the way you live your life, but your well-being. And when we think about later life, obviously we're talking about some of our relationships being extraordinarily long. We may have relationships that are 70 or 80 or 90 years old if we live that long, and we have siblings who live that long. So I always begin by inviting people to think about who's in your convoy or your network. And the first step I usually use with people who are struggling with relationships or hurting is to actually ask them to make a list. List the people who are in their world. Who's important to you? And I do it first in list form. And then once they've listed them, I start asking them to put them in these concentric circles. And this is the model that Antonucci and her colleagues have used, again, for 4 decades. And what we know is that when we ask older adults to do that, they do have networks that have quite a few people in it. 5 to 10 is average all over the world. The mean number is 8.9 to be very specific. And there's about 3.5 people on average listed in the inner circle, another 3.5 in the middle circle, and 2 in the outer circle. Now I can tell you that's a little different from older adults. Number one, it's a little bit smaller. There are fewer people listed. And the bigger change is that there are fewer people in the outer network. That older adults tend to hone in on the network that is in the middle, and those people take on increased importance across the lifespan. What we also know from this research, and it's truly a robust set of studies over much time and many people, we know that older adults report the same amount of satisfaction with their network, even though they have fewer people in the network. So the actual shrinkage of the network does not seem to be a problem. So who's in that network? Well, 80% of the people in older adult networks are family. Now, it's quite different if you ask that question to a 25-year-old. You'll see a lot more acquaintances and a lot more friends. But older adults have both friends and family, and 80% of it is family. It's almost always the closest person to an older adult is a family member. So family takes on increased importance. It turns out that across the lifespan, people report feeling closest to the people in the generations next to them. There are exceptions to that. I hear that all the time from my students who talk about a particular grandparent that was of exceptional importance to them growing up, and they feel closer to that person than someone else. But in general, people are closest to people in their own generation or the generation adjacent to them. And it's also the case that, in part because of longevity, siblings play a really important role across the lifespan in many families. My point is that older adults tend not to be alone. They have connections. Certainly they experience loss, no question about it. And we most importantly know that those who are alone are at the greatest risk of almost every bad thing that you could want to look at in health or mental health or social outcome. So let's turn and talk a little bit about why we're in relationships or what they do for us. Most relationship theorists make a distinction between two big purposes that we have for relationships. One purpose is attachment. Most of us need a person in our life that is our person, to pick up on the Grey's Anatomy analogy. It's our person that helps us feel safe in the world. It's the person we're going to rely on for caregiving and to whom we're going to give care. This attachment relationship helps us feel grounded, and it actually helps us manage our emotions. So if you think about the sort of child model for an attachment relationship is the infant mother, infant father, the primary person who's the carer, and that infant is really reliant on that carer. And when the infant can get to their primary carer and have full access to that carer, the infant settles, feels fine. When the infant cannot, the world is upside down. The world is unsafe. It's not just I'm unsafe because you aren't here. Infants can't make that discrimination. It is the world that's unsafe. At some level, that's still a part of us throughout adulthood. We need to feel like we've got attachment in the world. We matter to someone and we have safety somewhere. And that allows us to feel grounded. You can imagine that when we go through a time like this COVID isolation time, the people who can't get to their attachment figures or the people to whom they're attached, there's an exceptional level of distress when you can't get to your attachment figure. Another purpose, however, for relationships, in addition to attachment, is community. Community is really different. I can move cross-country with my attachment figure and still feel lonely and alone if I don't have community. Community is where we belong. It's our companions. It's the people with whom we do shared activities. It's the people that give us new ideas, the people that we bounce things off of, that we play with. We all need a sense of belonging in community. Now, this concept of these two big categories is certainly not original to me. Robert Weiss is the person that really brought that to the fore in thinking about loneliness in the 1970s. And he said you could be lonely for one and not the other. If a person has neither, they're highly at risk of being lonely. And loneliness has its price. So when we go back and we think about doing an audit of our relationships, the people who are in those different categories in the circles, we could think about them as an audit of the riches that are available in relationships. Who is it that makes you feel safe? Who is it that touches your heart or gets you thinking or gets you hungry for excitement or gets you moving, who reaches out to you in times of need because they need you. You're the giver. Relationships are not replaceable. That's an obvious thing. And yet, when we lose a relationship that has played a particular role, we can look around and think about how else can I meet those relational needs in my life. This becomes really important during periods of time like new widows and widowers who have lost let's say, a positive companion, perhaps from decades. Not replaceable in that form, but the functions of that can be replaced if you think about it creatively. Now, this is also important because relationships are so critical to health, both physical health and mental health. We know that loneliness predicts death in older cohorts better than blood pressure. Now, when that study first came out, John Cassiopo's work at the University of Chicago, we were all pretty much in shock about the amount of variability in death rates that was accounted for by loneliness. And the study has been replicated in a variety of different ways, and the data vary a little bit, but the principle is the same. Loneliness is a powerful predictor of mortality and morbidity, illness onset. And of course, the ultimate irony is that it's often the case that the onset of chronic disease, or maybe even more importantly, the progression of chronic disease, can render a person more likely to be isolated and therefore at risk for being lonely. But keep in mind, loneliness is not the same as solitude. Most of us value solitude. We need solitude to regenerate, to regroup. It's like needing sleep. We need it. So you might want to think a little bit about under what conditions does solitude invite loneliness? It's an important distinction to make. It's loneliness that gets us in trouble. Loneliness tends to have an anxiety component that we can't get to what we need socially. Whereas solitude is just the settling in to the quietness of our own inner experience. That Clark Moustakis made this point in the early 70s, a very important distinction. Loneliness is also, social engagement, I should say, is also associated with brain health, and loneliness on the flip side. It's at the structural level. There was a new study that just came out this week in the Journals of Gerontology Psych Sciences that looked at the microstructural integrity of gray matter, right down to the actual biology of the brain. That social relationships having solid social relationships is correlated with having a healthier brain and having that brain activate when you see people, having your brain engaged. Well, I do want to talk a little bit about how relationships change across adulthood. I mentioned earlier that older adults have somewhat smaller networks and yet equal satisfaction. Well, how does that work out? How does it come to be? Well, one principle that, again, has benefited from, well, I guess at this point, over 30 years of very robust research is a theory that Laura Carstensen and colleagues at Stanford University have developed and elaborated called socio-emotional selectivity theory. General principle is we become more selective with age. In fact, it turns out that anytime time is limited, our focus shifts to what time we have left. We're getting ready to move across country. We focus ourselves on what time we have left, not on the 20 years we've been here necessarily. And when we do that, we start to prioritize the closer, more important social relationships. The ones in the center of that concentric circle diagram are the ones that we want to spend more time with. We invest more under conditions of limited time in relationships that are we believe are going to bring us well-being. Now let's think for just a moment about a 20-year-old. I see students on campus all the time who are living in a dorm. They're living in the tiniest room they've ever lived in their life, and it's shared, usually. Now, why would they do that? Why would they give up a robust, large room in a house where everything's provided for them to go into this tiny shared space in a dormitory. Well, they do it because social relationships matter in a different way in young adulthood. Yes, social relationships always bring perceived well-being, but in young adulthood, we value highly the information sharing aspect of relationships. Relationships allow us to gather information from other people. And when you're in college, you want to be with a diverse set of people. 6-year-olds on a playground, they don't care whether they're similar to people or not. They want to be with diverse people. The bigger, the better, the more, the better, with personality variability, of course, around introversion, extroversion. But as we move through the lifespan, and particularly toward the end of the lifespan, when we have an awareness of limited time, that's a period when the function of relationships we tend to value the most is the ability of that relationship to increase my sense of well-being, the emotion regulation, the sense of affirmation of my identity. I care a bit less about the information function of relationships. I care a lot more about being with people that make me feel good. Now, one reason then that those relationship circles have fewer people in them in later life is that people have become more selective. They have less likelihood of listing 45 people in the outer ring that they might have listed when they were younger. Now they're going to be more selective, but selectivity is not the only reason the network shrinks. It also shrinks because they've actually experienced social loss. So not all network pruning is voluntary. People experience death, moves, loss of function that interrupts the operations of the relationship. And so social loss becomes an increasingly salient experience later in life that shapes the relationship structure and its function. And when those losses happen, and especially when they happen in long-term relationships, those are in general irreplaceable as a relationship, but the functions may still need to be filled by someone. I remember very clearly as my mother moved into her late 80s, her making the comment to me that her friends were now all gone, her close friends, her closest sisters, and her closest friends who happened to be older than her. She had outlived them. And she made the point, there's just no one else that has walked my whole lifespan with me that remembers when we were all rearing children together. There just isn't. And so that's important. That's just a fact, an aspect of social relationships. Let's also keep in mind that not all relationships are wonderful. Relationships are filled with negatives and positives. Conflict is a normal part of relationships, even good relationships. And it also turns out that there is a subset of people at any point in the lifespan, including later life, who report frequent and intense relationship challenges. We encounter in the mental health setting pretty regularly people who have cutoffs within their families. They have children that don't want to meet with them. They have siblings that are cut off from them. And those people are at considerably higher risk. It's also the case that most of us in our relationships have some degree of ambivalence. We have both positives and negatives. By the time you've lived a few decades, you tend to have had the idealization that there is Mr. Wonderful or Miss Wonderful or the perfect social network. You kind of get it that that's not feasible, that all relationships come with positives and negatives, and we just kind of have to accept that. That's the concept of ambivalence. We have two valences. We're ambivalent about many of our relationships. So the assumption that is sometimes made in social service settings or housing settings that someone needs more in order to feel better may not be such a good assumption to make. It might be wiser to kind of inquire about what are the trade-offs within each relationship. Oh, I forgot my picture was popping up there. I love that picture. Transitions and change are stressful at any point in the lifespan. We know this. Carter and McGoldrick in their series of textbooks on family development have reminded us repeatedly in various ways that as families move along, stress is often the greatest in transition times. When someone's leaving or entering the family structure, when there's a big change in someone's functioning, that's often a time of stress. And families are challenged during those times to restructure themselves, rebalance themselves, renegotiate how nurturance is going to be given, how conflict is going to be handled as you have a different constellation of people available to do it. So there's a lot of realignment. And I think especially people who work in case management or who work in housing and even in healthcare, you know, we are witnesses. We're walking the journey with people as they're in those transitions. My own research is on caregiving. And I've been interested my whole career in how families make transitions and the conditions under which they do them well. And the general theme to me that just stands out over and over again is that when I intersect with a family in the lab or the clinic or the classroom, you know, this is a family with a very long history. I'm stepping into a rushing river and I don't know much about their history. I can't make very good assumptions until I know them better about what would benefit them during this time of transition. So I want to now shift focus and talk about what we can do, because we all know connection takes effort. We don't stay connected with people if we don't put effort in time, intensity, commitment, resources, because in fact, relationships will atrophy if we don't feed them. And we have to feed them the resources they need to be robust and healthy. So one of the ways in which we feed them is we keep balance. We pay attention to the balance between the people who are close to us and the people who are in the outer circle, who are our acquaintance network, because we get different needs met by different people in those different positions. So the people who are closest to us, who can help us manage our feelings, help us feel good, sustain our identity from a lifespan, those functions typically can't be met by our acquaintances. So if we lose people in the inner circle, we have to spend some time with people in the middle or outer to begin to move them in, to have more time with them so that they can serve some of those more intimate functions. On the other hand, people who spend all their time only in the inner circle and have no acquaintances have nothing new introduced to their lives. It's one of the real joys for me of watching people who move into senior housing and get often surprised by how their well-being picks up. They actually have a whole new network of people that with whom to do companionship functions. Maybe not the intimate yet, but the companionship functions. We have to be kind of diligent to keep balance among our connections so that they're not all of one type. We do know that big personal challenges, whether it's a health crisis or it's something like COVID or it's something like anything else that's going on in our world, big fires, big personal challenges also challenge our relationships. And I chose to speak of it here in terms of routines. We all have we honestly have familiar arguments in our relationships. We don't tend to argue in new ways in old relationships, long-term ones. We tend to argue maybe over new content, but it's pretty familiar argument. You could map it out pretty easily. On the other hand, we also can have those ways in which we connect to people and are nurtured by people that are very familiar, interrupted by these big challenges. And so I just sort of invite you now to reflect a little bit on, during this COVID challenge, who's reached out to you? Who's put the effort in to make connection during this time of challenge? And similarly, with whom do you initiate contact? Who are you reaching out to? Within your intimate circle, your middle, and your outer. Have you put effort into those places? So what modes of connection can you use? You know, in COVID, we pay a lot of attention to what we can't do. I've paid attention to the relationships in my life that rely on incidental contact, running into people in the hall that I just like. They brighten my day. And now I don't run into them in the hall because I'm working from home. Which relationships in your world are still face-to-face? And for those that you can't see face-to-face, how have you stayed connected? What modalities have you used? I'm going to focus on that in just a minute, but I just want to pause here and really think about the fact that COVID gives us a real chance to, those of us who are not yet older adults, to model some of the changes that older adults experience when they move cross country to be near an adult child or into a facility, or when they change functions, something they can't drive now, or maybe their mobility is just compromised by knee problems and they can't walk like they used to walk. Changes in our functioning usually change our relationships. The frequency of contact, the who with whom we contact, the how we do it. So let's talk for a moment about relationship modalities. How can we be in touch? What are the ways in which we can have contact? Well, we can have touch, contact. We can talk in person. We can meet. We can write letters, something that's kind of fallen by the wayside. This might be a time to raise the possibility that it still plays a function in our society, and maybe one that we could resurrect. We write emails, we write texts, we write tweets, we write all kinds of things that communicate our thoughts and our feelings and our intentions. We can do video chat. One of the things that many of us have learned who have worked with older adults for decades is that older adults can do video chat. It doesn't take a lot for people to learn that. There are some who don't want to or can't, but the majority of people can if we put the effort into giving them that opportunity. Telephone chats. I've personally benefited more from telephone chats than I normally do in my life during the COVID crisis, because that's been a way to stay connected. I've hiked a lot. I can do parallel play. I can hike a few feet apart from somebody I consider relatively safe, and we can have a good conversation, and it's face-to-face, and it's pretty safe. Sharing a common experience, some kind of parallel play, whether it's doing words with friends online, or it is attending some meeting in a safe way, or it is participating in a meetup group online. Finding ways that we can share a common experience, what we call with children parallel play, where each of us is playing with our thing, but the fact that we're doing it side by side like these birds on the branch. We're all singing, but there's something satisfying about doing it together. So sort of auditing the relationship modalities that you rely on a lot, that you're comfortable with, that you, maybe your go-to, and asking, are they still meeting all of my needs, can be a strategy to open the possibility that you might engage some modalities that you haven't been using as much, at least with certain people for whom that modality might really work well. Now, certainly in challenging times, we often have interruptions in our social relationships. So that incidental contact, for example, might be missing now, where you don't have contact with your coworkers, the person that you now realize you really debriefed a lot about last night's fight with your spouse, or your worry about your mother. You weren't really aware that you did that much of it with your coworker, and yet now it's become clearer. Or that your play friends do more than play, or that your exercise partners end up being people with whom you chat quite a bit and share quite a bit about your health or your worries or your possibilities or your plans. Your acquaintances, your faith community, the list can go on, the categories. What has changed in ways that you wouldn't have predicted and certainly didn't plan? They just have. That's another way to kind of audit your network and think about your network, because embedded in those changes is usually some loss. Sometimes there's gain, although in COVID, often we've gained more solitude time, which for some of us has been great. And for others, we've lost enough social connection that it's made a difference for us. Well, I want to shift now and speak about more difficult relationships. I'm going to call them dangerous connections. COVID has created a bit of a pressure cooker. What the family scientists around the country have said on various listservs that I monitor, some of the top people in the area of family relationships have been trying to sort of pay attention to and categorize what's the impact of COVID on families. There have been lots of positive impacts. Families spending more time together under one roof, less fragmented, less pressured, less torn a million directions. And the summary that one colleague put out there I thought was pretty astute, which is basically that healthy families are probably enjoying each other more now in some ways than they ever have. But the unhealthy families are feeling in a bit of a pressure cooker. And so all the unhealthy components of family relationships are likely heightened, more salient, less escape, less opportunity to get away from them. So the simple point is that not all relationships are positive. We see in later life some marriages and partnerships and siblинghoods that have been chronically conflicted. Because I work with caregivers, it's not unusual for me to step into the middle of a family that's been fighting for 50 years, and now they have to figure out how to do caregiving together. It's not most families, but there are families that have chronic conflicts that are, COVID has not helped necessarily. There are people who are at risk for abuse and neglect as one particular kind of conflict. People who are highly vulnerable and really rely on a relationship for their very fundamental needs. There are, within those caregiving relationships, some caregivers who've become resentful in ways that they're struggling to manage because there's no exit, there's no break. And there are care recipients who are feeling very trapped. They've got an N of one providing care when they used to be able to maybe have a wider network of people with whom they connected. So when we think about these negative relationships, we cannot be surprised that negative social exchanges have a negative impact on health. You might be surprised that most negative social interchanges are within our closer ties, and in fact, most abuse happens within our closer ties. And the predictors of abuse are things like having a carer for a vulnerable person who is him or herself also dependent, whether it's on substances or on that person financially. It's a pressure cooker. There's not enough resource to meet the needs of everybody in the situation. Certainly we know, just as an example, low warmth in a marriage predicts cardiac disease in women, not in men. Men almost always benefit from marriage in almost all circumstances. There are a few maybe exceptions, but women, that's not true. Women don't always benefit from marriage. And when there's not warmth in the relationship, that's one that cranks up their risk for cardiac problems. In challenging times, even good relationships are hard, though. And I just pointed to a couple of dimensions that I've been paying attention to. How time rhythms are off. They're just different now. People are experiencing it as too much time together or too little time together. People who are living, maybe have young adults who have moved home to be near family during this time may feel like they've got more time with family than they want. Across generations. On the other hand, many of us who have loved ones in long-term care facilities with whom we've not been able to spend time are feeling very, very torn about having too little time together. In the retirement community, in the retirement transition, we often talk to couples who are getting ready to go through that transition about thinking about what's too much time and what's too little time, and how do you ask for separateness without having to get mad about it and push someone away? How do you just ask for it? How do you just negotiate it? The old adage of, I married you for better or for worse, but not for lunch, takes on some important meaning in retirement. And when people suddenly who've been spent a whole lot of their 40s and 50s trying to have more time to spend together because they were so over-involved in many roles, now have a lot of time together. And so just learning how to negotiate that and talk about it without it having to become an argument is important. And then there's this other thing of pressure on the people that we see frequently. Sometimes if we have too small a network, we put pressure on 1 or 2 or 3 people to meet all our social needs.
Mm-hmm.
And that's not realistic and not appropriate and not fair. Or to absorb all of our pain.
Mm-hmm.
That, we may need a broader network to distribute that, to disseminate that, to spread it around a little bit. And so again, going back to those modalities, if we can open up to some different modalities of communication, even during COVID and other kinds of challenging times, sometimes we can broaden the network away from what's immediately visible and in front of us. Across all relationships, we need boundaries. We need boundaries around, I think of social boundaries as kind of like skin. Skin keeps our guts in, our most vulnerable parts in, and yet it's permeable. Things can pass through skin. It also keeps certain poisons out. And so we need social boundaries that do that. We need to be able to keep our guts in with some relationships that just aren't safe. And we need to be able to have permeable boundaries where people can cross over and can meet our needs, sometimes even in novel ways that we hadn't anticipated. Boundaries usually involve setting limits on the who, the when, how often, maybe even the where or the how. Yes, you can talk to me. Yes, you can share anything you want to share with me. Yes, you can unburden your heart to me, but not after 9 o'clock at night. Or I'd just like a warning. Just let me know that you need to have a good cry with me. Okay, I'll do that. And then I won't enter the conversation ready to share. I'll enter it ready to receive. Sometimes we just need to kind of give some signals about what we're needing, or some signals about what we don't want or what we can't tolerate, what we can't do. We cannot be all things to anyone. The concept of codependency, I just saw a headline in a magazine that it's 40 years old. We've learned that it's not healthy to be codependent. We need to have boundaries around what's inside me and what's inside you. And then we need to come together to share and to meet each other's needs. So risk factors to watch for people who are in potentially risky situations or toxic situations might include someone who just quits doing things that they were doing. And maybe that's depression, maybe that's health change, or maybe that's an overwhelming vulnerability in a risky relationship. So that someone who used to take their dogs for a walk now doesn't leave their room because when their dogs come out of the room, they feel, this person feels like she and her pets are at risk for being yelled at by family, verbally abused. People become disheveled or have trouble sleeping or weight loss without reason, or someone who knows what they need medically and they've been given prescriptions, but they don't get them, whether it's walking aids or whatever. People who are getting notices for eviction, for whom that's not been a pattern. Time to investigate that. Could be a change in cognitive functioning, but it could also be that someone is acquiring their funds and they can't keep up with the rent or their mortgage payment. So these are sort of the risk factors that you can see here that we need to pay attention to in each other. So I want to end by coming back here, and then I'll have some time for questions. Coming back here to what are the keys to maintaining strong connections? I've tried to give you several of them, and I'm going to share them here in sort of a summary. One of them is to pay attention to who's in your network. Audit the network. Who's doing what in your network? Who's close to you? Who's in the outer circle? And identify what areas of loss you've experienced due to whatever challenge you're in, and what areas of gain. Recommit yourself to having relationships at all levels of closeness. You don't need 1,000, but you need some. Find a modality to try with regard to a relationship that you're wanting to rekindle or connect with in a different way. Pay attention to balance between separateness and togetherness or closeness. We all need both. And sometimes the situation we live in has positioned us to have way too much separateness or way too much togetherness. And we need to figure out how to balance that without having to make the other person bad. You never call or get out of my face. I just wanted some space to myself. We don't have to be mean about it. We can just say what we need. Pay attention to what we need. It's just a need. And then we can say it. And certainly watch for those who are at risk around us. And I know on this call are people who work with older adults in various settings. Your role as an observer, your role as an inviter, inviting people to pay attention to what's changed, inviting them to consider how they could recommit to doing something about it, to address whatever losses or gains they've experienced in some new ways, perhaps. And to just pay attention to what each of us needs, or each of the people that you serve needs. That's important, in addition to watching for risk. So with that said, I'm going to now pause and take questions, which means, let's see.
And I have a few for you, Dr. Qualls.
Great.
So
I was hoping
there's some great questions. So can you elaborate a little bit? Suze has asked, what about our relationship with pets? What role do they play in all of this?
You know, there's really wonderful research that shows what incredible benefits pets provide. That pets are a very meaningful relationship. They do all kinds of things. Like my dog makes me get up and go out in the very cold weather in the morning that I would definitely not go for a walk in, and start my day that way. And I see awesome sunrises and breathe differently because of it. I also think, especially in the time of COVID, pets can be a source of touch. They can be a source of cuddling. They're also people who need us. They're beings that need us. And sometimes we get ourselves moving in order to meet the needs. On the other hand, they can bring risks. So someone who with reduced mobility or reduced ability to handle responsibility may suddenly be a bit overwhelmed by a pet. And again, people around might want to just pay attention to that and offer what you can do to help with that if there is something. I have a acquaintance who just had a horrible bike accident at age 80, and she just adopted a puppy and was so excited about this puppy, and unfortunately sustained some pretty significant injuries. And it was a hard decision, but that wasn't the time for her to begin training a high energy puppy when her mobility was going to be limited for months. So, we have to balance togetherness and separateness. Pets are a great source of social connection.
Terrific. Rick asks, how might we replace the gaps left from our losses? And do these have the same value?
So the answer is, it's complicated. I think what I've tried to say throughout this talk is that there are certain relationships we're not going to replace. When my sister dies at some point, that's irreplaceable for me. We have a relationship that's has as much longevity as my life, because she was 10 years old when I was born. She's been an important person in my life. So that will be not replaceable. There will be no one who remembers me as an infant. That part's not replaceable. But I can pay attention to, how is it that we talk? How is it that we reminisce? How is it that we connect? And with whom else could I do some of those things? So while it might not be that someone can remember me when I was 2, I might now be reminiscing with another generation about what I remember from when I was 5 or 6 or 7. So again, if you look at relationships as sort of a fact, they're not replaceable often if they're very long term. But if you look at them as a function, you can actually think, when I moved cross country and my best friend didn't, I replaced some of the functions of that friend, and I call her for some of the other functions. So I think if we think of it as what are the functions, then we might be able to open ourselves to finding people that can fill some of those, or finding other modalities. I mean, looking at old pictures might fulfill my need for reminiscence when I can't find somebody who was there.
Mm.
So it's not always that everything gets filled with a new person. I personally am finding myself in my 60s needing fewer people and more alone time. And some of that is
Yeah.
because I get from books something
Mm.
different. I get from music. It's like an
Yeah.
old friend to me.
Yeah.
So, we replace things in a variety of ways. The point is having an intention and committing to doing it.
Mm.
Great. And with about 10 minutes left, we've got 3 or 4 questions, so want to make sure we get through these. Steve asks, any comments on how sensory impairment, such as low vision, hearing loss, how does that impact relationships and contribute to the loneliness?
Well, hugely. I can say, first of all, and I can say that there's no question that hearing disorders create more problems with depression and even cognitive decline than vision. Because what hearing is, if we can't hear another person, it's very, very hard to be connected. And it's very hard to participate in a social setting. Sounds like somebody's got a mic on. Just check and make sure your mics are on.
Dr. Qualls, you can actually turn off Darcy. So if you just look on your participant list.
Okay.
Thank you. Oh, she heard us. Thank you.
Oh, okay. Thank you. Yeah.
Yep.
So let me get my thought back.
So about hearing impairment.
Hearing is of
Yeah.
profound importance. And people miss so much information when they can't hear, or they distort it. The hearing loss distorts it, so they think they heard, but they didn't. And then their participation in the relationship changes also. So hearing is just such a hard problem. I have loved ones that are so profoundly hard of hearing, and it's just really challenging. So let's think about our modalities again. What might I try with someone who's profoundly hard of hearing, who still has vision, that might not rely as much on the spoken word? For those who have both hearing and vision loss, it becomes much more difficult. And sometimes that's when we rely on touch, which right now is a tough one, because people with profound hearing and vision loss right now have limited touch. So for some loved ones in my life, I try to make sure that they can use taste and smell. So I can't go into the facility to visit. I can take flowers, and I can take lunch, favorite lunches, and I can talk on the phone to the extent that it's possible with someone profoundly hard of hearing and blind. But it's going to be limited. So I look at other modalities. What else can I do? How else can I create touch, a new nightgown, and just something sensory? It's really important. And I think much understated in our understanding of how important.
Great. Thank you so much. Rebecca asks, many of the risk factors that you've discussed are so similar to how individuals living with dementia look. Mm-hmm. Are there any thoughts on how to discern this?
A good evaluation. I thought of the very same thing when I made that list. I'm so glad someone commented about that, because it's kind of like temperature. Temperature and pain are very nondescript symptoms. It takes an expert to dig down through and do a good evaluation to figure out what the source of it is, right? Same thing's true with relationships. Someone who has a profound difficulty participating satisfactorily in their daily life or their relationships, it is also showing us a nondescript symptom. We don't know what it means. It's obviously a source of problem, but we don't know what the source of it is. It could be cognitive impairment that is keeping that person from initiating activity, or for looking disheveled, or for not participating socially. Or it could be that they're at risk in a relationship. They're afraid. They're afraid to anger an abuser who might withhold food or neglect them out of retaliation. So you're absolutely right. Those risk factors are important to pay attention to, and then you need to get a good evaluation so you can figure out what the source of it is.
Terrific. And Kristen just asked, can you give some more examples of the relationships that comprise each ring and circle in the network?
Sure. So typically in our inner world, we talk about maybe the people that are our closest family or our closest friends. So if I were going to talk about my inner circle, it would be children, and it would be siblings, and it would be my closest friends. My next circle are the friends that I've put a lot of effort into getting together with during COVID. These are people that I set a Zoom visit, FaceTime visit, or I meet them in the park every few weeks or months, and we sit far apart and we have a cup of coffee in the park. I put effort into that. Those are friends. And those are ones that I've noticed I now am missing. And I've kept good contact in the middle, but that middle net in the center, that middle circle is the group where I think we're often at risk for. It's harder to make connections. They're not everyday connections. They're not our closest peeps, but they're important to us. They help us sustain parts of our identity and who we are. The outer circle is what I call my acquaintances. These are the people that, in my case, I might work with or I might see at the gym regularly. People that I would notice, people that sit near me at church and I visit with, but it's not a deep level. But they're people I would call on. Someone I might call on for help or information, or someone I might go to a play with. People I do play with, people that are my acquaintances. Even people that serve, like maybe your attorney or your tax person. Those of us that are a little older at that stage where people are starting to retire. It's like, whoa, wait a minute, you can't do that. You're in my circle. You're my trusted person for that, whatever that is. The people I get together with for Super Bowl Sunday or whatever, some event once a year. They're not close. They're not even regular friends, but they're my acquaintance network. I like seeing them. I like running into them. That's what I would give as examples.
Terrific. And it is 2:57. I know some of you need to jump off at 3 o'clock. We have about 3 more questions, which are excellent. So if you do need to leave us, no worries. But for the rest who would like to continue the dialogue with Dr. Qualls, Dr. Qualls, if you don't mind us just going over a few minutes
I can
to get
do
these
it about
questions
5.
answered.
Mm-hmm.
Okay, perfect. So let's get to the next question. Terry asks, is there a difference physiologically or otherwise in talking to people face to face versus the environment we're in right now where everything is Zoom?
I don't know the answer to that. There may be one. I haven't seen the data, but I haven't gone looking for it. It's a great question. And do those physiological, if they did exist a year ago, are they the same today would be another fascinating question. I just don't know the answer to it.
Okay. I think there'll probably be a lot of research around this once we kind of get through this time on Zoom. So the next question is, Juliana has suggestions for loved ones that are living in assisted living and you can't go physically visit. Writing things on a whiteboard outside of their window, is that really productive, or are there other suggestions of how to interact with our loved ones when we physically can't be next to them?
Totally depends on the person and you as to what's satisfying. I will tell you, I have a loved one in a facility who is profoundly deaf and blind. And so her ability to hear the phone when it rings is very low. And so unless I set a window visit where the staff take her to the window and they set up her phone on speaker properly, there's about a 25% chance otherwise we're going to have a satisfying conversation. So for me, a window visit's worth it, even if it's 10 minutes, because I got that conversation that I can't get by just calling her because she can't see to find the phone or answer it properly. So that's one example. She's the person I take lunch to. I know what she loves and I know what kind of flowers she loves. She can't see them, but she can smell them. I can send in food. They won't let me take food that I've made, but I can take some of her favorites. That's a way of communicating. I can call and ask the staff person that I trust the most to actually spend time with her during the week to read a note. I can call the nurse's desk and say, I sent a note this week. I don't know if anyone's read it to her. Would you make sure it gets read? So I think we have to adapt in the ways that we adapt. I don't know for every single person what the most meaningful thing is. I also don't know what many of us have wondered about the trade-off in loss of robustness and health due to social loss versus the risk of COVID. I mean, that's an ethics issue. If, in a way, it's irrelevant. It's taken out of our hands. It's a legal issue. But the ethics issue that has been wrenching to so many of us has just been so hard to watch people be impoverished socially and know it's taking a toll. We all, I'm sure, know people who will say, my loved one died, I'm sure, faster because of this. So those are, oh, it's just such a hard time. It's such a wrenching time. I would, again, try to work with, you know, any of your facilities to see if it's an option to be outside at 6 feet away with masks on. Some of them have allowed that at times, and then unfortunately our numbers are going up. So it's not likely to be happening now in Colorado anytime soon. I would never have thought that my father, who's 97 and living in another state, in independent senior housing, but still limited to his apartment, I would never have thought that we could do regular Zoom meetings with him. Actually, we do Facebook Live, which is really challenging for me, but he manages it because somebody taught it to him. And so my family of origin meets together across 4 states every Sunday afternoon. We never did that. We are having more contact than we ever did. So, you know, you just have to be open to the possibilities and pay attention to what's meaningful to the particular people involved. You just have to look at that feedback loop.
Right. So there are some positives. Our last question for you is, with someone who's been dealing with depression and other mental health issues prior to COVID, what would you expect to see now that we're 6, 7, 8 months into COVID of folks that do have these mental health issues?
I would expect to see an exacerbation of symptoms. And I would expect that in part because this is stressful no matter what. Under the best of conditions, it's stressful. And when you add stress on top of an existing depression, you're usually going to see an exacerbation of symptoms. The intensity or frequency is going to go up. However, hear this carefully. Depression can be treated during COVID as effectively as it was treated before COVID. So there's no reason that person who may be extraordinarily stressed due to loneliness, depression, anxiety, shouldn't be in treatment. Telehealth works. I can tell you, I've been doing it for months now, and I've had clients achieve their goals and accomplishments and terminated, and they're doing fine. So don't hold yourself back from reaching out for services. A survey done in my community in Colorado Springs showed that many older adults are not going for regular health checkups. They're not doing their dental, their vision, their hearing, their doctor's appointments at the same rate because they're afraid of encountering COVID in a medical setting. And in general, I think most of us would say that medical settings are doing an extraordinary job of trying to keep extraordinary levels of cleanliness because of the risk there. So you have to think about what would be the risk of not getting treatment during a time, an extended period when you are experiencing an exacerbation of symptoms. I just want to tell you, telehealth really works. It may feel odd at first. I train students to do telehealth, mental health services, and it works for them as students. So don't suffer alone. Don't suffer without the health and mental health resources and interventions and assessments that you deserve. This is a hard time. It's hard enough as it is. Definitely don't try to do it alone or without the resources that you need. Otherwise, you can expect that you will deteriorate or your loved ones will deteriorate. But with treatment, change can happen.
Terrific. Well, thank you so much, Dr. Qualls. This was a wonderful presentation. We're only 5 minutes over, so thanks to all of you for giving us an additional 5 minutes. This was a wonderful discussion. Just a quick reminder that next Thursday at 2 p.m. Mountain Time, we will have Dr. Sherry Gibson, who will be addressing compassion fatigue. And also a reminder, if you could just take a couple minutes to fill out the evaluation, that'll come through your email. We would greatly appreciate it. So on behalf of CU Anschutz Multidisciplinary Center on Aging and the University of Colorado, Colorado Springs Aging Center, thank you so much for joining us today. And we look forward to seeing you next week. Take care.
Goodbye.